music can do things which language can't.
When I learned that more than 90% of a resident's time is spent idle, let's try this and see what difference the iPods would make.
I have one resident that video went to eye, she didn't respond. Nothing worked. It was amazing once we put the iPod on her. She started shaking her feet, getting all off. I'm seeing her all over again. I'm going to take the meeting for 1 second, okay? Just to ask you a few questions. Okay?
Yes or no questions?
What does music do to you?
Give me the feeling of love, romance. Because right now the world needs to come into music, singing. You got beautiful music again. Beautiful, lovely. And I feel a vein of love, dream.
Of music therapy and dancing applications, something very powerful and primal is at work.
This iPod keeps me happy. It keeps me from crying. And when I'm upset, all I have to do is turn up my music. And it soothes my nerves, and I go fast asleep.
And with an average cost of about $80, this is less than most people's daily medication costs. In terms of what difference it makes for the quality of life for an individual who's able to receive this, is just immeasurable. So for me, I can't think of any greater value.
Snippet. If you watch the 6-minute video of Henry, he's got his head down and he's not responding, and they put the iPod with the headphones on, and he actually sings Cole Porter songs, and he sings very well. So it's worthwhile to watch, and Alive Inside is good as well. It has more features of different residents that respond to music. So that's basically what it's about. It's cool.
Thank you, Jane. And just really quickly, I heard that folks are actually putting their requests for music in their advanced directives.
That's great to hear.
All righty. Well, thank you so much. And then we have Kate Townley, who is our built environment specialist, and Kate's going to talk to us about building
slides in here.
Yes.
So I'm Kate Townley, and you can see I'm a Merc Mud. My background's in urban planning and urban design. I'm pretty new to the health department. But I don't exactly have a program that's directly related to healthy aging, but our work in the built environment definitely has an effect on older adults and their ability to get around the community. I'll go ahead and skip this one. So, healthy community design is really where my work intersects with healthy aging, and that community strategies that support quality of life for older residents really support, benefit people of all ages. So some of the things that we look at are streets and sidewalks, and the ones that work for 80-year-olds are going to work for 5-year-olds as well, and people with strollers. We think about housing, and housing that's connected to essential services, and also housing that can allow for family-centered care and access to parks and recreation and things like that. And we also look at land use that can support physical activity and access to transportation. So some of the things that we want to ask is whether or not the communities that we live in and communities across the state support growing older and growing older in place. And do we meet the needs of our citizens for all ages from 5 to 105? And do you feel as though you can successfully age in place in your community? So as a planner, the things that we do is look at what policies are in place and what policies can we change that can help facilitate aging in place. And we can do that through zoning codes, design guidelines, master plans, and many different tools. So one of the things that we've done here at CDPHE is we've looked across the state. We looked at all 64 counties and about 170 municipalities to see what sort of active living policies are on the books. Now, my focus in my work plan is typically on obesity reduction by increasing physical activity and also sunshade. So I don't necessarily address healthy aging, but many of these elements are things that you need for healthy aging communities. So we looked at across the state to see who has policy language to promote walking and biking, to promote traffic calming, pedestrian connectivity, pedestrian comfort and aesthetics. That's something we'll dive into a little bit more because that's very important for healthy aging and being able to move around your community. We also looked for public transportation and pedestrian-friendly land use. That's where you have a mix of services in a compact area, so you can walk from place to place. So this pedestrian comfort and aesthetics, you can see it's one of the areas where we have the least amount of policy around the state, but does have, and I'll just dive into that one a little bit deeper. So one of the things that we try to promote for age-friendly outdoor spaces is shade and benches. There's many different things, but these are just two that I'll highlight right now. They found through different research that communities that offer shade and benches are considered more exercise friendly and find residents of all ages who are exercising more. And it has more protection from the sun and from heat as well. They've also found that even perceived availability of greenness is associated with more physical activity and better mental health as well. Benches is something you may think of as promoting sedentary behavior, but it's really can provide aging adults a sense of comfort. You may only feel comfortable walking one block, and then you know you need to be able to sit and rest. And so knowing that a bench is out there and you have that ability to rest may make that difference between staying inside for the day or at least going out and walking one block or multiple blocks. So it's through design guidelines and different regulations that a city may say whether or not they have these amenities in place. So these are things we promote as we talk to different communities. Another piece is age-friendly streets. You may hear of complete streets or complete street policies, and this is where you can have people of different mobility levels as well as mobility types. So whether they're in a car or biking or walking, they have a safe place to travel. This is also a place where we really need to have a lot more of attention at the local level. In my community, for example, they say, well, we have sidewalks. We do. They're about 2 feet wide, So it's really the quality of sidewalks in places where people can walk are very important for being able to age in place. We found that, according to a 2008 AARP survey, that 40% of older adults say they do not feel as though they have adequate sidewalks, and 47% say they cannot cross their main roads safely. You can see up in the corner here, we often have cross signals that are maybe 10 seconds to 15 seconds, and that's something that we really need to consider as we're working with our public works directors and other folks to ensure that we have enough time to cross the street. And you can see here we often have cracked sidewalks or sidewalks that are too small, and that is something that we can bring up to local city council as a way to either change their prioritization of capital improvement projects or provide grants to private property owners in order to improve their sidewalk conditions. And Sally, are you there?
Yes, I am.
Sally Thorson's on the phone, and so I just wanted to say that one of the areas we wanted to talk about is fall prevention, and that's not my area of expertise, but I have a couple slides in here, and we have Sally on the phone as well.
Hi Sally, I put you on loud.
Okay, okay, hope I'm not too loud.
This idea of sidewalks and having cracks in the sidewalks and uneven surfaces, it definitely increases a fear of falling and falling in while you're outside. They have found through research that 1/3 to 1/2 of falls of older adults occur during walking, and that a Boston study found that older adults fell more often when they're out shopping on errands and trying to do day-to-day activities rather than walking for recreation. And also that dual activities, so walking and talking at the same time, was also more difficult for older adults. So these are things that we need to consider as we're designing communities and creating design regulations. So here at CDPHE, the Violence and Injury Prevention Mental Health Promotion Branch works with a cooperative agreement with the CDC and the Administration for Community Living to work on fall prevention programs. And they develop and implement evidence-based programs for fall prevention. They have the Stepping On program as well as a Tai Chi program. And they deliver these programs through recreation centers, hospitals, trying to have more medical providers recommend these programs and try and get more patients into these programs. And this is a way to help increase confidence and also to prevent future falls. A few of the goals are to increase the number of older adults who are at risk of falling, increase that number who are now participating in these fall prevention programs, and then also to engage more healthcare providers in referring people into these programs and to also find sustainable funding mechanisms for these programs to occur in communities. And I'll let Sally add on. She has a lot more information on the fall prevention and how it's basically that idea that we can build the environment, but unless it's safe and unless it's people are comfortable in using it, we don't want to increase their risk of falling.
Kate, I think that was great. You're hired for the program. You're hired as my PR person. Yeah, we have been working on getting evidence-based programs out in the community, and I work in the Grand Junction office, but I work on statewide fall prevention projects. So we've got a number of the Parks and Rec in the Denver metro area doing a Tai Chi class that's really good for fall prevention, and most of the hospitals in the Denver metro area and a number outside of Denver metro are sponsoring Stepping On, which is a great class to get people doing some exercising, thinking about their solutions in their home and that kind of thing. And I know one thing we're always looking at when we do these programs, getting them embedded in organizations and Parks and Rec and hospitals, is to be able to reach our full audience of older adults out there. And starting out, we've been able to make some good inroads, but certainly have not been as successful at getting to some of the communities with disparities and bringing the programs to locations that we need to also serve. So I think this group is a great one for me to be connecting with on additional opportunities. So thank you.
Well, thank you, Sally, and thank you, Kate. So now we're going to move to the folks from the Senior Center, and I'll let you see, decide who takes the lead and which order you go into. Thank you.
So we are from Eaton Senior Communities in Lakewood, and we're an independent and assisted living facility. Gwen Million is our Director of Social Services. Sarah Schroeder is our Wellness Director, and I have just completed my foundation year student internship with Eaton. I'm a Master's in Social Work student. So it's actually nice to return to be in their midst here after spending the year with them. We really come into the conversation from the angle of affordable housing. The numbers that Tony mentioned during his presentation, you know, the reality that the number of older adults in this country, which means adults over 65, is going to double in the space of just 40 years. And that's one of those statistics that I think I hear and go, wow, that's big. And then when I really try and digest that number and also think about the resources that are currently available and how those will be stretched as that population grows. So Eaton is a facility that utilizes funding through HUD and through Medicaid, and so we're an affordable option, and the model at Eaton is really trying to do that in an innovative way that looks at wellness and looks at the dignity of the individuals, and not just allowing an affordable option, but really trying to do it, I guess I could say, in style. Really trying to offer services to the older adults. So we'd like to share some of the things that we're doing in our environment to both highlight the need for the affordable housing, and then also some of the ways that that can be done, particularly in community, when adults are coming together to live in community. So Gwen, do you want to?
Yeah, I can take over from there, and just to let you know, our mission statement, our vision statement is really, really what drives us to do what we do. Let me review that with you. Our Eaton Senior Communities mission statement is to provide affordable housing and a service-enriched environment that enables all to live to their fullest potential, and everybody deserves that opportunity, is how we feel. Now, we have a foundation there as well. Our Eaton Senior Communities Foundation mission is to obtain the resources for Eaton Senior Communities, to provide seniors with a variety of affordable living choices, and to support programs and activities that enrich their lives. So as you can see right off the bat, it's all about value. It's all about value, and what is it that an older person wants, and I'm in that category now, so I can certainly say, yes, I want to remain valued in our society. However, so many people miss opportunities to continue to make a lot of money, to continue to own property, and to continue to work, because we know in the United States of America, that's what's of value, right? So in moving into Eaton, we really do work at, and we work hard at valuing the senior who has very, very low income, who has lost opportunities to work due to illnesses, chronic diseases, and conditions like that, and who don't own property anymore. So our vision statement then is to become the leading creator of partnerships, innovative solutions, and communities designed to support aging well. And our community, our leadership team, several years ago, got together and formed this vision statement. And these are the statements that really drive us to do what we do. What are those things that older adults typically struggle with in our setting? And I do believe it is those feelings of value, as well as those feelings of empowerment. How can I feel empowered to get what I need? And so it takes advocacy. It takes strong advocacy to work with our seniors, to support them, to provide them with I've told student interns as I go to various internship fairs, they'll come up to me and ask me about opportunities for therapy and that sort of thing, because most students like to go that avenue. So I tell them that we're not an organization that provides therapy per se, but we are an organization that when needs are met, housing and food and socialization and advocacy and that really strong sense of value, well, what happens? Our emotional well-being comes alive. And we feel like we have, an opportunity to be involved and to be cared about and to be heard, because being heard is so crucial. It's not what I want, it's what the client wants, it's what the resident wants, and how can we help them get there. So I'm going to turn it over now to Sarah, so Sarah can talk about our incredible wellness program that we have at Eaton, and we've passed around, brochures.
Hello everyone, my name is Sarah Schroeder, and I've been in geriatric nursing for over 30 years. I've worked in skilled for over 20 years of it, the first part of my career, and then I learned the model of PACE, and now here I am at Eaton as a wellness nurse. I have been there for about 2 years, and when I started, my position was about 20 hours a week, and I didn't quite understand this whole thing about wellness. I knew that I was a very good clinical nurse, but I didn't get this bigger picture where we have this whole person wellness. So it's been a learning curve for me. My position is funded by grants and private donations through the foundation, and I'm happy to say as of last October I'm there full-time because it's that important and that critical to being successful in our community. So I get to run up the bills. My social worker here pays them. So we're a
find the funding.
Yeah. So those are always good first people to meet when you start a job. But what we did with our wellness program was that we have a very small budget, obviously, because I'm a grant employee. But we found partnerships out in the community, and those contacts are everywhere. They're sitting there wherever you go. You just don't realize it. So we took and created partnerships with many, many nonprofits like COA. You're talking about Stepping Up. They've been in our community. It's a wonderful program. But we also found other providers, medical providers that share our mission, and we are looking for people who provide quality service. And so with that, we brought on board, we have a veterinarian that comes in and offers very economical rates for pet care, because our pets are very important to us and they're part of aging and aging well. Sometimes they fill that void when the children have grown up and left the nest. We also have the holistic pieces where you're talking about the Tai Chi being important for balance and fall prevention. We have Tai Chi in our community. Our provider is wonderful. He also brings on-site acupuncture. And we also have a massage therapist. We have those holistic components, but we also have those traditional medical providers. So we have dermatology, we have foot doctors, we have audiology, we have a dental hygienist that comes in and provides on-site dental care. Physicians, we work with some of the on-site physician groups to come in and serve our people medically as primary care providers, because the things that our seniors face and it becomes really serious for them is they don't have access to medical care, because maybe it's too difficult to get to a provider's office, or I get there and now I have to navigate the parking lot into a very large building. So what happens is they simply don't go, or they go infrequently, and so they're not monitoring that Coumadin or those health conditions. So we have found different providers, and we really look at who's coming in. They really need to share our mission and have that love for seniors that we do. And by doing that, we've gone from we had a good infrastructure, but now we have something really amazing. And we know that what we do is really important because it's the right thing to do for our seniors, but we give them their quality of life back. To me, a good day is when you come to pick up mom, instead of taking her to the doctors and getting her medicine and blah, 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 you and mom now go to dinner and you take her to your son's baseball game. You guys have quality time together. So with our wellness program, we also partner with Metro. Now she's coming on board as a social work student, but we also were able to tap into the resources of the integrated health program. And so we brought in health coaches. That's kind of a newer program at Metro. So we get these interns for about 6 months, and they come in and they work with our residents on health coaching, fabulously successful. The residents at Eaton own their wellness program. And when we bring students in, they adopt them and they love senior success. When they get intern of the year, they're cheering them on. They want to be at that capstone with them. So they came in as health coaches and we've connected them to many people. And sometimes what I try to do with my interns is I try to find some of those wallflowers. People that don't typically stand out, we connect them with these kids and they just blossom and they take ownership and they're leading the pack. We have, in our assisted living, they're actually more active in many of the wellness projects than our independent side because we serve both facets. So with that internship with Metro, we also have from the integrated health practices, kids that come in with a strong holistic background. So they educate us and they perform some of the activities like they taught us yoga and they taught us qigong and meditation and things that traditionally our age group are a little bit kind of iffy about. Well, guess what? It's wildly popular and the residents love being a part of it. So I think the things that are key to success with wellness is it's the right thing to do. We can give the people all these services and have them on board, but if the residents don't want to buy into them, it just doesn't matter. And what makes Eaton special is it's that team approach. We all work together and we all envision the same things, and by that teamwork approach, our wellness program is very, very successful. And we feel that we have a model that can be shared with other communities that are affordable housing, and that it's something that, you know, should be the way of the future.
And it didn't happen overnight.
No.
It was part of, long-range, strategic long-range planning, about 5 or so years ago, when the board and the leadership had gotten together and developed that we need to really focus on wellness now. And really, when you think about it, it is so much more positive. You know, we've looked at seniors in the past with that medical model, and there's something wrong with you, so we've got to treat something wrong with you. Where this is a much more empowering concept, where people feel so much better about themselves and they become a part of it. They buy into it. So many do. They buy into it, so it's empowerment. And so they feel so much better about themselves. You know, you work on a healthy aging plan. We work with a consortium called Collage. It's a national consortium out of the East. And a software program was developed, and it's called Collage. And that's where we do our, what's it called, the Healthy Aging Survey, Health and Wellness Survey, and then a lifestyle survey. And through that, then, a healthy aging plan is developed. You know, medical model or case management models are, you know, got a problem, and what's the intervention to fix it? You know, well, this is totally different. So it's good stuff.
Thank you so
Well,
much.
and I should also interject too, real quick.
They're cutting us
Yeah.
off.
They're cutting us off, as I can tell.
Sorry, I know that each one of
We're
you
excited.
can
We're
just
excited.
probably do a couple hours on the wonderful programs that you run, but before we go into our interactive piece, let's give our panelists a hand for their wonderful information that they shared.
Thank you. I'll start out a question pointed to you, Sarah. Thanks so much for coming and being a part of this. Every intricate piece of what we pulled together here makes a lot of sense from internally to externally, and I hope that together the four of you can continue collaboration to work with the Office of Health Equity and what we really want to do here at the office. And Sarah, I heard you say something on the way over here which is really important. First you said about partnerships and building community, and one thing you're doing is you're actually coming back here soon to talk about some of the Medicare. So just tell us laser that idea for me, how you're going to come back and support us too.
Well, we're going to be back in August. We're doing one of the REACH series, and we're going to bring with us part of the leadership team, and we're going to talk about wellness and affordable housing and how you can develop these programs. And we're going to be doing a 3-hour segment, and they're going to break it up into 6 parts. So each of us will speak for half an hour. So you're going to get to see a large division of what we do.
What's the date, do you know?
I want to say it's August 18th.
We'll get it out to the team once we find out more details, but thank you. I'm glad you're coming back. I'm glad we can support the partnerships you guys are trying to build. Does anybody else have questions they want to ask today?
Comments?
I have a question. I'm curious as to what the actual physical setup is. Are these buildings where the folks are living and it's just like in a community setting? They have their own little place?
Yes.
Yes, assisted living is, of course, assisted living community with assisted living apartments. And then the independent community, 161 apartments, okay?
And
It
what's
does accept
what's the age?
62 and over.
What's the income guidelines? Are they all low income?
Pretty much. So
they're
we do
Medicaid
accept,
eligible,
well,
basically?
the assisted living, Medicaid eligible, some, and private pay.
Yeah.
And then the independent community is, accepts the HUD subsidy.
Okay.
So HUD subsidy and market rate.
I have a question for Kate. Do you have, you indicated, and Sally had indicated wanting to create a bridge over the gaps of underserved communities of information, of finding out communities that needed the support and better walking systems. Do you have, or have you utilized any GIS or any spatial data that indicates the growth of the expansion of the aging community in coordination with maybe their capital investment in infrastructure? Have you seen any of those maps, and have you utilized that information?
We haven't at the state level in terms of looking at walking infrastructure. I think that's happening a little bit more at the local level or with regional, like metropolitan planning organizations. So I think that's important information to have.
Absolutely.
We do, with groups that we work with, we do walking audits often to work with communities to be able to go out and look at their own walking environment and see where improvement may need to happen. And then I would say, yeah, at a city level, especially in Denver, they're looking at mapping more walking environments across the city to see where there might need to be areas to prioritize capital improvements or sidewalk improvements and things like that.
There are a couple of questions that were here.
I just have a question. You were saying the families, you were looking at how taking care of your family impacts the caregiver themselves, and I was wondering if you could just give some examples of what that caregiver can do for themselves in order to be better. I'm just curious.
Well, many of the caregivers we talked to have either left their jobs or were working less in order to take care of their family member. And so as a result, I mean, there are many issues around that, but the number one thing they wanted was respite. They needed a break. You know, I think for many caregivers, there's never a break. You know, even if you're away, it's always on your mind. So, but that was really the number one thing that we found that the people with it. I think secondly, it's just the economics of it, and particularly for what we found with Latino families is that you know, there's less wealth accumulation because the person has left their job, the caregiver, and then the older person is being encouraged to spend down assets in order to qualify for services. And so you've got this issue here where, you know, the caregiver then is their Social Security is going to be less, their income is less currently, and then they're out of the job market for many years, and yet there's no transfer of wealth from, even if they're small assets, there's, you know, the house is gone for the elder. So that's kind of an issue as well that's happening. And so what we want to look at is how do we help preserve that so that, you know, there isn't that whole spend down, so that there is some transfer of wealth that can happen and that can help the caregiver to, you know, not be in the same position or even a worse position than the person that we're taking care of.
I think what you're talking about, though, is that Medicaid spend down piece, and that the caregiver can't even pay themselves through that whole time of caregiving, because then they actually would have to pay back, is my understanding. And then they get in debt because, then their parent isn't. So it's really a mess. And and I think that piece is hugely important nationwide because of the aging population and how we might advocate for that whole financial stability piece for the caregiver, because they get penalized for their actual caregiving activities. And if there isn't a wonderful resource like yours that where the Medicaid individual is eligible, then like in smaller communities, everybody's stuck, right? Everybody's stuck in this place of the caregiver burnt out, the caregiver not getting paid, the resources going away, and then everybody's in worse shape because of our aging community. I don't know what the answer is to that, but it's big.
I think the answer is partnerships and building community and Medicare grants and
Affordable
developing
housing.
grants. Equal
And
housing.
there, just this last year, I think in the Colorado Senate, there was a bill passed that does allow family caregivers, maybe you can speak more directly to that, but that does allow a process for family caregivers to actually become an employee, a caregiver for their relative.
Well,
So
but
that then they can.
That's been in the disability world for a long time, that they become a CNA, or do they become a CNA, a certified nurse assistant, to do that?
It's a little different than that, I think, in this recent legislature,
But I think they still have to be poor to be paid. I think the individual
It's still
has to
coming
have
through
all this
Medicaid.
unpaid. Yeah, they have to have no resources to become the paid caregiver in the system. So there's nothing, no legacy left. The house is gone, everything else is gone, before they can actually get paid for their services, I think.
But if it's moved through this year, it means the progression is occurring, and we can continue to have that conversation to impede change and to move the idea towards away from getting rid of your legacy. Right, we all want to leave a legacy when we leave, right?
Well, and the whole idea that, you know, you're looking at a wellness model instead of the old medical model, and, you know, this population that's moving into this older population, these are the flower children. These are the ones that want peace, love, and understanding. And they're the ones that made the changes because it didn't work the way their parents did it,
And
so.
they're the ones that will not end up in skilled facilities, and
Yeah.
the population in skilled is going down because of
Yeah.
other programs. 2% of the population over 65, I think, is what we see in long-term care. But it will go down, and the flower children and the
Yeah.
baby boomers will not tolerate the
They won't.
conditions that we see.
And they know, because it's promoted so much, they know the power that they have
Oh, they've got the
because of their numbers.
Yes.
That's kind of exciting.
All the way through, all the way
Yeah.
through. The baby boomers have been the focus, so.
Well, one of the advantages right now that we're able to take advantage of, Medicare is supporting more home-based services. So part of the reason that we've been able to build up the physicians coming in is because Medicare and Medicaid are paying for those to be brought on site. And a few years ago, that wasn't possible. If a doctor went to your home because you couldn't get in, you lived 30 miles out of town, and tried to bill, that's Medicare fraud. Well, guess what? Now we have this opportunity that Medicare pays for things to come to Eaton. So 5 years ago, we could not have done that, but today we can. And so that's been a huge advantage. Hopefully Medicare won't change their mind, but like you said, we're the baby boomers and we want it different, you
Yeah.
know?
The youngest baby boomer turned 50 last year. Yeah, so we are definitely in that.
We're gonna do the
Power to the
difficult-
people.
Yeah, we're gonna do the difficult ones.
Well, if we have any more questions, now's the last chance. If you guys have something you want to say?
So I have a question for you. You were talking about improving the environment for like sidewalks and stuff. So your suggestion was if we were concerned about like sidewalks and things to start, was it with the city council?
Well, that's one of the things I think, and with this demographic as well, is often at those meetings and often has the ear of maybe city council. I mean, I think that's it's a good place to start, or knowing where the problems are first. We always have issues in some cases with sidewalks, whether or not they're being supposed to be maintained by a private property owner versus the city. But it's becoming an issue everywhere, and requiring private property owners to always maintain them is not necessarily sustainable or a way that we can count on. So I would say it's something that to encourage going to those local policymakers and saying this is an issue and we need to come up with a plan. In cities like Grand Junction, they were able to get their city council to decide to spend their community development block grants on improving sidewalks. Because it does benefit everyone in the community in all ages. So my suggestion.
Well, thank you, because we have a lot of property where the residents like to walk, and depending on where they're at, some of the sidewalks are in poor condition. We've had you have falls, so you know how to advocate so that we can encourage them to get out and take those walks, which they want to do. They want to get outdoors.
Well, and that can be something, and I know AARP has some guidelines as well as we have some local organizations that could help with members of the community to do a walk audit and to present that information to City Council and ask, see if those private property owners as well as City Council can do something to fix those conditions.
Okay, thank you. Thank you. Sally, do you have anything to add in our closing?
No, I don't, but I appreciate the opportunity to hear what everyone's doing.
Yeah, thank you so much for joining us long distance, Sally. We really appreciate it.
Well, thank you so much, everyone, and this is just the beginning of dialogue. So we will, as we move forward with our strategic plan on healthy aging, I'm sure we're going to identify other opportunities for networking. Thank you so much for your time, and have a great rest of the day.
Yeah, thank you guys for coming.
Thank you.
Thank you.
Let's see,